My friends, in your Eye on Health tonight, I'm going to talk about something important here. Thousands of Americans are waiting for a second chance at life, and you can help. We're taking this moment now to highlight Donate Life Month. So joining us tonight is cardiothoracic surgeon. We've got Dr. Katie Fenton with Baylor Scott and White joining us in the studio. We wanted to take a closer look at heart transplants. Thank you so much, Dr. Fenton, for being here with us. Talk about this a little bit. How many people right now, as we speak and sit here and chat about this, are on this list waiting for a heart transplant?
There's approximately 4,000 people on the heart transplant wait list right this moment.
Wow.
They have end-stage heart failure, so all other resources have been exhausted. So this is really their last chance effort at a life because they are so critically ill.
Yeah.
And here's the kicker. Texas is actually the state with the most people on the heart transplant list. We are number one with 430 people.
Yeah, I had a feeling you were going to say that. So how does this work? Because 4,000, obviously that's a big number.
Yes.
And they're waiting on donations on people who have the will and a healthy heart to donate. Mm-hmm. How many people actually receive these hearts when they need them?
Right, and so that really depends, right? So some people wait over a year to receive a heart. Not everyone overcomes the time that they need to actually receive a heart. So there is a shortage. We don't have enough hearts, and even though they might be willing and able to receive a transplant, they might get too sick by the time they actually have an offer.
And that's the devastating part about all of this. It can't happen fast enough. Obviously, you see this every single day, and you know the importance of it. And that's why we're trying to tell folks about this.
Yes.
And get the word out. Talk a little bit about the gap that exists between the patients, again, that are waiting. You talked about it a little bit, and the number of transplants that are actually performed.
Yes.
Because, you know, I'm sure you all are trying to move fast, but you need the heart in order for this to go forward.
Absolutely. So first of all, about 5,000 heart transplants are performed every year in the U.S. per year, right? We currently have 4,000 on the list. Imagine that difference. So despite us doing more heart transplants right now than we've ever done before, we still don't have enough hearts available. And so really it is all about donor heart availability and trying to close that gap. So it's really about becoming an organ donor and making that gift of life available.
I wanted to ask you, this increasing number, this need, do you think because medical advances have gone so far now that we can detect who needs it earlier, or do you think people's hearts just seem to be in need of more repair these days? Or is it due to the fact that doctors like you can make that determination a whole lot earlier?
Right. I think we certainly have a better system for detecting some of these illnesses. I think some people were just passing away without knowing what was happening. Okay. And now hopefully reaching out and providing better and more care to individuals has helped us kind of bring that increasing number together. But it's also because the incidence of heart failure is simply increasing. We don't have a good reason why, but the numbers clearly state that we have significantly more individuals with heart failure now than we did even 20 years ago.
And I guess that's what I was backing up into right now. I was trying to get an idea if this is an increase in heart failure and unhealthy hearts and what's behind it. So you're saying we don't really know.
Right. There is genetics. We're doing a lot of research, and we're really trying to figure out what the reason is. And of course, we always think about healthy lifestyle and everything else we can do, heart attacks, all the things that may lead to needing heart transplantation. But all that comes together in one pot where we have seen the numbers skyrocket, and we haven't been able to turn down the numbers, even with our medical advances.
And that's alarming, I think, for a lot of people who are sitting at home and trying to wrap their heads around what you're talking about.
Right.
I mean, that is something, but that again speaks to the need for these heart transplants. For folks who are signing up for this, right, to get on the registry to potentially donate, what do they need to know about what they're signing up for? Yeah,
absolutely. I think signing up to donate an organ can save up to 8 lives. One donor can really save an incredible, give this gift to an incredible amount of individuals, right? So it's really expanding on that need that is out there. And should something devastating happen, right, this is something where we're then ready to accept that gift versus not being able to utilize it.
One donation, 8 different lives. I think that's the big takeaway here, and I hope folks really understand that of what we're talking about here. Dr. Fenton, thank you so much for coming in to talk about this. Thank you for the work that you're doing. Obviously, we wish you all and your colleagues the best of luck with all of these donations. It's a huge need, and I'm glad that we're talking about it.